say, light up the lungs so that you can see things that otherwise you wouldn't be able to see. So your research is providing a new way of identifying problems.
Yes.
You're mentioning a host of potential uses, especially for people working in mining or working in other areas where the lungs could be impacted.
So what we do is we take either helium or xenon, and we polarize it with a laser, and then we have research subjects, breathe them in.
Yeah.
So this is the first image when I co-invented this technology, and we published this in Nature magazine, which is a high journal in the literature, in 1994, and then later I was recruited to come here. And now what we're doing is we're imaging subjects with pulmonary disease, and this is a healthy individual. You see a homogeneous bright signal.
Yeah.
This is a subject with asthma, and you can see this heterogeneous signal, the dark spots, the signal defects. And the dark spots means that's where the gas can't go. So everywhere the lung is bright is normal ventilation going on. And where in asthma there's bronchoconstriction, the airways close, so the gas can't go to these spots that are dark. And this is very important because it can tell you what's happening when you're trying to treat people with asthma, when they're taking their inhalers, how effective are they, and so on.
Sure.
This is a subject from a patient here that has moderate chronic obstructive pulmonary disease, and you see large ventilation defects of the lung where there's destruction of the alveolar, the air sacs in the lungs, and this person is not getting very good ventilation. And this is a person with severe COPD, and you can see that there's even larger areas of the lung where they're not ventilating very well. So this technology that we're working on, hyperpolarized noble gas, lights up the lungs, and we could see where the lung is not functioning properly, and other imaging modalities cannot give you this information. So this is, and we're also working with miners looking at asbestosis and silicosis, so this is very important for the local community here.
What was being used before? I mean, you're mentioning now the ability to see things that you couldn't see before.
So
what was the medical profession using before?
So the gold standard is pulmonary function tests. You breathe into this spirometer.
You're looking at capacity then.
And you get, the how forceful, exhaling the gas in 1 second. It tells you nothing about what's happening regionally in the lung, doesn't give you regional information, doesn't give you images. It's really in the, technology from the Stone Age.
So your research will highlight the area, the problem areas.
Absolutely.
Give you more information in terms of diagnostics.
Gives you regional information. We can quantify the ventilation, the defect volume, and it really tells you about function. And clinicians, when this is finally approved, respirologists, we're collaborating with Dr. Barubi Beeman in the hospital here, they could use this information to make daily decisions about treatment and maintenance of their patients, because they need to know, is the medication their patient's on, is it working or is it not working? Do they need to switch them? What do they need to do?
And you'll be able to see if it's working or not.
Absolutely, with these images.
So how soon before the technology can be used?
That's a good question. It's very difficult to answer. It's got to be, Health Canada's got to approve this. We're also working in the States with the FDA. So it'll take several years before that happens. But the research we're doing now, we have to collect this data to submit to them in order for that to happen.
Right.
So that's what we're doing now.
Excellent.
So one example that I can show you, this is research with subjects with asthma, and you can see at day 1 there's ventilation defects here, and if we image them 45 days later, sometimes the ventilation defects persist in the same place, but sometimes they go away and disappear.
Yeah.
But if we give them a drug called methacholine, which simulates an asthma attack, causes bronchoconstriction, the ventilation defects reappear 45 days later in almost everywhere in exactly the same positions. And this means that during an asthma attack, the same airways, the same regions of the lungs are spasming and causing bronchoconstriction. And this means that asthma is a local disease, not a diffuse disease as was traditionally thought. So this is new information which doctors can use to locally treat patients with asthma with local therapies.
Well, now you're narrowing the field.
Yeah.
You're not using the silver bullet approach
Exactly.
versus a shotgun approach.
Exactly.
Yeah.
So these images were done with helium, but we can also do the exact same thing with xenon. But xenon also, when you breathe it into the lungs, it also dissolves into the blood and goes to the brain. And these are images of the brain in animals. We're just starting out. This is new research. This is an animal that got a stroke. And you can see these are the traditional diffusion conventional MRI technique. And this shows the area where the stroke is with tissue that is dying, brain tissue that is dying. And this is the xenon image, and it shows you basically the same information. This is the area, the core of the stroke, and this is where there's proper blood flow. And it matches the histology very, very well. And you can get all of this information with one shot with xenon MRI. But more importantly, we're doing functional imaging with xenon. These images on the left, 3 different animals, and it's just showing the baseline distribution of xenon in the brain. And the images on the right were acquired after the animal got a pain stimulus in the forepaw, and the somatosensory cortex of the rat brain is lighting up. And what's important about this is, so this is functional MRI. And there's a technique that's used now conventionally. It's called bold fMRI. But that technique only shows you about a 2 to 4% increase in the signal. With xenon, we're seeing 50% increases in the signal. So the sensitivity is much, much higher, and it might be a new breakthrough in the field. The last thing I'd like to show you are these images over here. These are images of the lung. This is a slice when you slice down this way called coronal. These are axial slices when you slice transverse. And these were done with inert fluorinated gases, done by my graduate student Marcus Couch and our team. And these are important because these images do not require the expensive gas isotopes, helium and xenon, and they don't require a polarizer. So they're not quite as good yet as the hyperpolarized helium images, but they're pretty good. And this can be done very, very inexpensively. So, you know, we could get this approved by Health Canada. I mean, the track going forward is clear.
Yeah.
So, and this is going to reduce, and any, you know, hospital in Canada can do these scans with just a little bit of equipment. So this is very, very important.
And it's also very exciting to know that it's happening right here in Thunder Bay. So for our viewers, you know, this is very good information, because sometimes we view the hospital in isolation. You only go there when you're sick. There's a lot going on behind the scene in terms of research and applied research that is going to make our lives in the region and also beyond the region, because eventually this can be commercialized to help people anywhere in the world.
Absolutely.
So thank you for giving us this insight, and I'm sure our viewers will appreciate it.
Okay, thank you very much.